Georgia, if you can please call roll for attendance.
Yes. Counselor Lewis?
Present.
Counselor Rosenthal?
Present.
Counselor Wong?
Present.
Counselor Nolan is perfect. Council President Peterson is excused, and Counselor Simpson is excused, and Counselor Gonzalez.
Here, thanks. And before we begin our agenda items, if we could please play the safety video for our in-person attendees, that'd be awesome.
Laura Lepley, a Metro Park Ranger. Here at Oxbow Park, safety is our #1 priority, not only for our guests, but for our staff members. I'm at the Welcome Center and you're at the Regional Center. The council chambers are located on the 3rd floor. In the event of a fire or fire alarm, please exit through the door in the northeast corner of the room. Go down the stairway to the 2nd floor. Exit through the main entrance by the reception desk and gather in the courtyard outside that entrance. In the event of a medical or fire emergency, please call 911 and notify the security agent at the reception desk. The nearest defibrillator is mounted on the steps leading from the reception desk down to Grand Avenue. Thank you, and come visit us at Oxbow Park.
All right, thank you. So today we are welcoming back staff from our supportive housing services team to report on the 3rd quarter of the current fiscal year and the work happening on SHS. As always, we're going to hear some highlights about implementation of the program separated by each county. And we did receive some of this information over email to review as well. So it's a pleasure to welcome Yesenia Delgado, Supportive Housing Services Division Director, and RJ Stangland. Okay, thank you.
Yep.
Housing Finance Manager. Thanks for joining us.
Thank you for having us. Good morning, counselors. I'm Yesenia Delgado. I use she and her pronouns, and I'm the SHS Division Director. Today, I'm really excited to be here bringing you all a presentation on the SHS Q3 reports on some of the transformative work happening at Washington, Clackamas, and Multnomah County with SHS funded work. As you all know, the Housing Department has been providing updates to Metro Council on a quarterly basis. While there are multiple discussions happening around the future of SHS, today's presentation is really focused on updates and progress under the goals and commitments made under the current SHS governance and structure. As Council has been discussing for over a year now, there are needed SHS reforms, and that's part of the process to create a more person-centered and efficient regional system of care. And although that is really incredible work, there's still a pressing need today to continue to deliver these services. So that is what we're here to be talking about. As the folks that are closely working on reviewing these reports, we just wanted to provide you some updates on where we're at in meeting some of those regional goals, as well as sharing some highlights with you. I am joined today by RJ Stangland, who's our finance manager. So we will be presenting on the Q3 reports, which cover January 1st through March 31st of 2025. And today's presentation will really be an overview of where we're at with meeting some of those regional goals, sharing some specific county highlights, and then we will discuss some financial updates in terms of where we're at, and we'll wrap up the presentation with what's next and what you can look forward to hearing more about from us this summer. So this is really a condensed version of the reports that we're talking about today. I know that we sent you all the reports, and we highly encourage you all that if you haven't done so, to spend some time with them, because there's some really incredible updates and work happening at each of the counties. So yeah, with that, we can go to the next slide. So this slide shows the regional progress for the last 3.5 years of SHS program. So at the beginning of SHS, we didn't really unpack what a regional vision for the SHS funds would be across the region. We didn't create really robust system goals. We do have the 10-year goals that you all have heard about, which are to connect at least 5,000 households experiencing homelessness to permanent supportive housing, and to connect at least 10,000 households at risk or experiencing homelessness into permanent housing. So feedback we consistently hear from you all, or also the oversight committee, is that, as we present on these placements or eviction preventions, what's the context and what is the need in our community? The oversight committee has shared that reporting on placements and homeless preventions in relation to the 5,000 and 10,000 goal that I just talked about feels like we're missing the broader regional picture and the need that is out there and what are the solutions that are needed. So I think that's why it's really exciting work to see some of the work coming out of the president's work group to truly develop a regional framework, that includes a vision, a mission, some key system goals that would be tracked by KPIs, because I think that would really support some of the reporting work that we're doing year over year to truly measure the impact that we're seeing with SHS. But for right now, these are the main 2 goals that we have. As you can see here, for permanent housing placements, we're at 4,974 households. We've placed over 3,000 people since the inception of SHS into rapid rehousing. Both of these housing placements are permanent housing opportunities that support people in retaining their household. And then we have eviction preventions or homeless preventions, and we've done over 17,000 of those. And this is, again, these are households that are currently housed, that were at imminent risk of homelessness, that we were able to support them, keeping them in their house. And through SHS funding, we have been able to create and sustain over 2,000 shelter beds in the Metro SHS region. And again, this is additive to other homeless funding resources that you'll see in our community. So I think when you look at the numbers in this way, I think it's just really a testament to the incredible work happening through SHS. If you go to the next slide, this slide will really just show an overview of the current fiscal year 25 goals. So the counties submit every year what we call an SHS work plan that just identifies both quantitative and qualitative goals from the counties in relation to their local implementation plans, in relation to the Metro SHS work plan and other governance documents. So these are goals that they kind of create and submit for themselves, and then we measure progress up against those. So as you'll see here, the 3rd quarter this year, our region went from still working on reaching any of the goals at the beginning to now having met 5 out of the 9 housing and prevention programmatic goals by the end of Q3. So some really great progress, and you see some of the highlights here. We didn't list all the goals, but you'll see those in the reports. And I will note that this progress is mostly due to 2 unique factors. Both Washington County revised all of their programmatic goals for eviction prevention, shelter, and rapid rehousing. And I'll talk a little bit more about that here shortly. And also Multnomah County fixed a reporting error that they had been experiencing in previous quarters. And this really caused a large jump in their numbers that we saw for Q3. So yeah, with both of these updates, we are feeling really confident that we will meet the region goals for this fiscal year. And like I said, I'll talk a little bit more about both of these changes that we saw in Q3 as we get into the county individual slides. Next slide. So yeah, this slide right here provides an update on households served that are population A or B in Q3. Reporting in population A and B has been a challenging dynamic over the years due to inconsistent reporting methodologies, definitions, and templates. This has been something both that the Oversight Committee and Metro staff have brought to your attention before. But I am really pleased to share that for the first time ever, you are seeing population A and B data by quarter in this presentation. So this was the first time that we have this available in the reports. So I do think we're making progress. We continue to work with our county partners, have work sessions where we're figuring this out, making changes to templates, further unpacking what we'll be seeing in the data sharing agreement to ensure that, this core requirement of SHS, which is to be able to report on the 75-25 financial split, that we have the right reporting mechanisms in place. So, yeah, I won't review all of this here, but as you'll see here through Q3, you see an overview of the population A households served in each of these areas. And I think what's really great about being able to see this for the first time is that, as you'll see here, for example, 80% of households being served in permanent housing placements are identified as population A. Well, what's going on with these 20% that are population B? What is it that we need to work with the counties? Is there additional guidance that needs to be released to ensure that we are prioritizing this really valuable resource for those that are most in need? So that is part of the reason why getting readily accessible data is extremely important, so that we can make these program and policy decisions that we need to make. Next slide. Yeah, so I'm going to pivot over to talking a little bit more about county by county and some of the work that they're doing. So during this quarter, Clackamas County successfully hit 2 out of the 3 programmatic qualitative goals that they had around rapid rehousing and homeless prevention. They were also the only county that we didn't experience any major changes during this quarter. So they are pretty much moving through in the same way that they started the fiscal year. They are, as you can see here, about 60% of the way to their PSH goal. As I've shared before in previous presentations, this isn't typically uncommon given how much longer it takes to lease up for PSH. So we're still hearing that they're feeling good about nearing their goal by the end of the year, but we still have 1 more quarter to go and we'll see where they end the year. Yeah, and then they didn't add any new shelter units. So the shelter units that you see here are still reflective of the ones that I presented to you through quarter 2. Next slide. And some additional Clackamas County highlights include that they were able to establish and recruit for their new Community Homeless Advisory Board. So as you might remember, this is a requirement of the Metro SHS work plan that each county reports on, that they have an advisory board and is reporting results of that to us. So this group will comprise of community leaders who will provide recommendations to staff and the Board of County Commissioners on decisions around program improvements, resource allocations, and goal setting. So this group is really formed with the intention to review programming, planning, outcomes, and fiscal information to ensure that best practices and that we're able to evaluate the impact and recommend improvements to the decision makers at Clackamas County. So a few years in, it's really great to see Clackamas County being able to form this group and report that progress now up to us. Additionally, in quarter 3, Clackamas County also fulfilled their annual work plan goal to collaborate with their housing services providers to improve data quality for their local HMIS system. So they have really expanded their HMIS technical support with 2 full-time limited duration staff. One of the staff is bilingual and co-developing training for culturally specific providers in Spanish, which is really great work that is being funded through SHS. Also, as part of this data revamp work that they're working on, they were able to launch what they're calling a data information and request tracker to more accurately capture the needs from service providers around their technology needs and be able to streamline and respond to them. And finally, in March, Clackamas County also completed their phase 1 of their data warehouse project. And you might hear it described, they're calling it unicorn, and that is literally what they're calling it, but it stands for Unified Navigable Integrated Clackamas Outcomes and Reporting Network. And through this process, they were able to, for the first time ever, deliver on their by name list production data integration. So this is really transforming the way that they're able to have data available to support them in meeting and having timely and accurate data to inform program and policy decisions. So overall, we saw really exciting highlights coming out of Clackamas County in this quarter. If we go to the next slide. Yeah, so I touched on this a little bit a few slides ago, but Multnomah County in quarter 3 were able to exceed 2 of their programmatic goals, as you see here, in large part to revisions to their reporting method. So in quarter 3, Multnomah County launched a continuous quality improvement pilot for SHS reporting. The pilot specifically revamped aspects of their previous reporting processes that relied on a combination of automatic and manual data extractions and matching procedures to streamline and enhance Multnomah County's reporting capabilities. So as part of the work, they went back through their previous year's reporting to identify programs that were funded by SHS that maybe weren't captured in reporting programs. So they were able to identify these programs with a new method, compiling a comprehensive list of SHS-funded projects that decreased the administrative burden that staff were experiencing. So with this new methodology, they were able to provide a more extensive scan of the current available data in their community. And they were able to also identify programs that weren't previously being captured in previous quarterly reports that I had brought to you all. So this has led to an identification of households served with SHS funded that had not been previously accounted for. So we saw really notable increases in their Q3 report in areas of permanent supportive housing, with I think on the upside of like 200 households that had been missed, and both for homeless prevention categories. So, we've been doing a lot of talking with them to like understand more about this quality improvement process. They're feeling really confident that this work that they did will really support next year's reporting to ensure that this doesn't happen again. And they are able to more readily be able to like give us current households that are being served without having to like go back in time and update reports. Some additional updates for Multnomah County include, if you go to the next slide, they were able to, in alignment with their navigation goal for the fiscal year 25, they were progressed on the launch of a new program in partnership with the Salvation Army to provide outreach and navigation services in East County's cities, including Wood Village, Fairview, and Troutdale. So East County is, in the past, have been part of their local implementation strategies to ensure geographic access to their entire community. And at this point in time, East County has the largest unmet housing needs rate. So like they're really doing some intentional work to ensure that they are focusing some strategies, outreach strategies out there. Additionally, Multnomah County has stated that opportunities have arisen to strengthen family system programming due to SHS funding. In particular, there has been increased PSH services and SHS funded programs for family system programming. So this has been a population that they have felt like they really want to focus on, because sometimes the homelessness in this area isn't as visible or it just looks differently. So given that SHS being a flexible funding source, being able to like integrate those fundings into their family system of care has been a huge win for them that they are reporting on. And additionally, they were also able to open 2 alternative shelters, one being the St. Andrews Village, which opened in North Portland. This site provides 10 sleeping pods, and they all include kitchens, bathrooms, and a large community meeting room. And these are serving single adults that are 45 years or older. And if you go to the next slide, they also opened Oak Street Village Center that you'll see here in February earlier this year. They are providing this with straightaway services, and this also provides sleeping pods, sheltering up to 40 adults, providing 24/7 on-site services. That includes things like showers, on-site trash services, restrooms, laundry, and a kitchenette. So as you see here, thank you to Counselor Simpson for being there. It was overall like a really great event. So it was great to have our counselors there representing. Finally, I will just touch a little on Washington County. So if you go to the next slide. So Washington County, like I said at the beginning of this slide, they did submit a work plan amendment to update their goals for this fiscal year. So their work plan amendment was to update their rapid rehousing and shelter and homeless prevention goals. So they updated their rapid rehousing numbers to go from 500 placements to 300, so a decrease of 200. And this was largely due to like new programmings that they had started that they were just having challenges with, that they didn't feel like they were going to be able to meet this goal. Additionally, they also updated homeless prevention, and that went from 1,400 to 1,000. So it was decreased by 400 people. And they identified that they were having some constraints given the updated revenue forecast. So because of that, they were needing to like update that number that they had previously projected being able to serve. And finally, they also decreased their shelter units from 400 to 385. And so it was decreased by 15 beds. And that was largely due to the fact that they closed a motel voucher shelter programming, which was 65 shelter beds. They were always temporary, and due to the new shelters that they have opened, that's why it kind of balanced out at only 15 shelter beds. But like I said, this was the first time ever that a county has submitted an amendment to their work plan. And just so you all know, this information was brought to Metro staff and then to the Oversight Committee. And the co-chair of the Oversight Committee actually raised the need to have a more robust process, because currently in our governance documents, there isn't much around an amendment process. And by the time Washington County had brought this update to the Oversight Committee, it had already been approved by their commissioners. So again, the Oversight Committee members just flagged the need to have perhaps a more robust approval process for any time amendments are coming through. Of course, in this situation, the amendment that Washington County was submitting made sense, but the role that the Oversight Committee has in approving or not is a little complicated, and just an ability to like further streamline that feels really important to them. Yeah, and if we go to the next slide. So Washington County also was able to open their first SHS funded access center this quarter. So this is the first SHS funded access center to be completed by the county, with 3 more planned. And the center provides 60 beds, a commercial kitchen, laundry, and on-site showers. Washington County also celebrated the groundbreaking on a future year-round shelter in Hillsborough this March. And then finally, they were able to also report on some system improvement work for how they're moving forward in their racial equity efforts. So they have adopted Multnomah County's racial equity lens tool that allows them to ensure that they're having an equity lens as they're making decisions for SHS programming. So they are using that to like review some of their policies for the regional long-term rent assistance, as well as they have created advisors in different components of their departments to ensure that those decisions are being, that racial equity is being prioritized in decision-making in their county. If you go to the next slide, you'll see a little bit more about the groundbreaking that I just described for Just Compassion Shelter and Resource Center that happened in March of 2025. And thank you to Metro Council President Peterson for being there and attending and representing Metro. Yeah, that concludes my part of the presentation around specific county highlights. So I will pass it over to RJ.
All right, thank you, everyone. RJ Stanglin, he, him pronouns, Housing's finance manager. We can go to the next slide, please. To begin, let's take a look at the cumulative gross tax revenue collected for SHS over the last 4 fiscal years. You can see that the dark blue line represents this fiscal year 25. In January of 2025, there was 131.1 million in gross collections, which you can see was just above fiscal year 23's 117.6 million, but below last year's 149.9 million collected. In February, there was an additional 10 million in gross tax revenue collected, bringing the total to 141.4. And then in March, you'll see that it was still trending in a similar rate, where it was below both fiscal year 23 and 24 with 160.9 million. The total tax revenue collection for this period was about 62.3 million. And I think it's also important, because we do have the data right now, is to look ahead to the future months, because we can now see the spike during the 2025 tax season. So in April, there was an additional 90.1 million collected, which brought us closer to where we were trending in the last 2 fiscal years, still a little bit lower. Then in May, there was another 22.4 million, which does show that we're still trending below last fiscal year. But we are still on track to the fall 2024 forecast that was back in November, which should land us closer to the 323.1 million at the end of this fiscal year. Next slide, please. So now let's look at the spending by county. This slide shows the comparisons from year 3 last year to this year, year 4, spending in regards to quarter 3 actuals, as well as the full year comparison comparing year 4 forecast, which does include built infrastructure. As one can see, there has been significant spending increases from last fiscal year to this fiscal year across the board for all counties. When comparing the Q3 numbers year over year, you can see Clackamas had a 145% increase, Multnomah was 144% increase, and Washington had a 178% increase from last year at the same time. The total spending, when you aggregate it, it was about 155 increase from last year to this year at the end of quarter 3. All counties continue to be on track with their fiscal 25 spend down plans, with Clackamas and Washington trending slightly below their quarter 3 benchmark and Multnomah slightly above their quarter 3 benchmark. Each county should land close to their year-end benchmarks for spending when one looks at the trends from last year. When you look at quarter 3 actuals from year 3 to where they ended up at the end of year 3, there are significant spending increases as well. I mentioned this because one can see a similar trend when you're comparing the end of year 3 actuals to the end of year forecast spending, which is the bar chart on your right. However, the forecast does include those committed costs, especially for built infrastructure, that may carry over into future years depending on the timeline of those projects. So those forecasts may be an overestimate of what they'll actually spend by the end of the fiscal year. But those commitments will still roll over to next fiscal year. Next slide, please. And what did they spend the money on, which I think is probably the most important. In quarter 3 year to date for this fiscal year, the counties have spent $281.2 million. And this pie chart breaks it down by the program categories, the largest being permanent supportive housing, $79.1 million, about 28% of the spending. Safety on and off the streets at $65.3 million, or 23% of the overall spending. System support costs at $57.1 million, or 20% of the total spending. And rapid rehousing at $31.2 million, or 11% of the total spending. And I also want to point out that when you average all the county's admin costs, it comes in about 4%, or $11 million. And with that, we'll go to the next slide and see what's looking ahead.
Yeah, hi again. So I just wanted to give an update on some of the oversight administrative functions that the Metro Housing Department will be leading this summer. So this is a quick overview, and I'm happy to further unpack this and some of the 2-on-1 meetings we have or come back to you all this summer. But as you all might remember, the data sharing agreement was ratified by Metro and the 3 counties in spring of 2025. So we have been working with our internal Metro IT department to ensure that all the details for how the counties will send these reports securely to Metro are figured out. So by the time that we are getting these reports in August, everything is ready to go and we can start to do some of that data validation, evaluation, analysis that we've been wanting to do for quite some period of time. So we do plan on engaging with counselors over the summer to share a little bit more about what you can expect as we start to get this data, and also hear from you any things that you all would be curious about or want us to dig into further in the data. Additionally, as we head into the summer, this is also usually the time of year that we do work in updating our reporting templates, both on the program and finance side. So we are doing this continued system improvement work to ensure that our reporting templates are as accurate and provide us as much information, and that they really have this integration between the program, finance, and data to be able to track all of our requirements as efficiently as possible, as well as being able to do analysis that can then support with decision making as we are in the midst of multiple different decisions for SHS. Additionally, a critical oversight function of any funder is that we monitor implementing partners. Now, due to due to the current SHS governance structure, we do have to negotiate with the counties on what we would like to be monitored on, and then they have to like agree to that. So after over about a year of negotiations with the counties on monitoring, we have reached an agreement on a framework that would include monitoring the counties on the implementation of population A and B, their financial infrastructure and systems that would include their process for provider payments. So that is what we'll be looking at monitoring. We've set dates with 2 of the counties for August and are working on the 3rd county. And as part of that work, but a little different, it's really 2 sides of the same coin, is the evaluation work that we are also planning on doing. So we are working with PSU's HREC on developing an SHS evaluation framework to really be able to start capturing and evaluating how effective we have been doing with the SHS services that we are funding. So that can support in, again, like decision-making and knowing what are the kind of programs that we should continue to fund and maybe do more of, what are some of the programs that there's maybe challenges or opportunities, and how we can like course correct and work through that. And then finally, we are continuing to do population A and B definition alignment work. So as we've been kind of looking further into how we're tracking for population A and B, we have just found some opportunities for better alignment on the application of the population A definition across the region. So working with counties on that, in addition to ensuring that by October, when the annual reports are due, that we have the most up-to-date reporting templates, definitions, and methodologies to ensure that we're able to report on the 75-25 split later this year. So like I said, really great work happening in Q3. Q4 will be busy into Q1 of next year for Metro's housing department staff working on some of these oversight administrative functions. So thank you so much for the time today, and we're happy to like answer any questions that you all might have.
Excellent. So we'll go to conversation and questions. I see Councilor Nolan with their physical hand up. So
Thanks, Mr. Chair. On that last slide, please, the looking ahead, if we could bring that back up. Can you tell me on the county monitoring and evaluation, is that committed to writing? What's the form of agreement between Metro and the counties to effect those changes?
So the IGA kind of gives this clear language for the monitoring framework that we were to develop. So that is a framework that's currently in writing. I could totally share with you.
Within the original IGA?
Mm-hmm. Yeah, there's monitoring language in there that indicates that both Metro and the counties have to agree on what needs to be monitored.
If I might follow this line of understanding, what have we changed then?
In the IGAs?
I thought when you described that bullet of county monitoring, you said we had changed something to make it better. If the language exists in the original IGA, what did we change?
Yeah, so apologies if I misspoke. There currently haven't been any changes to the IGA. There have not been any changes to the IGA agreements. What we did do is for the last year, negotiate a monitoring framework that's in addition to the intergovernmental agreements. So this monitoring framework is a document that then includes the monitoring language from the IGA in addition to what Metro would like to monitor and how we're going to do it with the counties. So that's what we've been in the middle.
Thanks for that explanation. We haven't changed the IGA, but we've added something to interpret it.
Yeah, I would say that that's correct. And an additional document to the IGA language that includes how we will monitor the counties.
Great. And forgive me if you've already done this, but can you send it to me again so that I can be aware of it? And I'm also interested in the evaluation framework. Is that in the same process where the original IGA language stands and there's a separate document that we have signed, someone has signed on behalf of Metro and someone on behalf of each of the counties, or how did that become a new way of doing things?
Yeah, the evaluation language in the intergovernmental agreement is a little different. It doesn't say that we have to agree with the counties on what exactly needs to be evaluated. So that is more work that Metro has been leading at this period of time. So we did sign an IGA with PSU's HRAC team. And they're the ones as a third party really helping us develop a framework and a scope for how we will evaluate the Metro region on the efficacy and how we are meeting and counting towards our goals and commitments for SHS. So it is also like a separate process and document, but not with the counties. It's more like an administrative function that Metro is leading at this time. But of course, there will be engagement with the counties.
Okay. And my last question has to do with your last bullet point here. Great to move toward alignment on what population A is and how we evaluate an individual county's process through time, but also the three counties in comparison with each other and totaling up to a regional approach. Can you describe what that definitional line is and
Yeah.
where it's documented?
Yeah, so we currently have a population A definition in the Metro SHS work plan. So it describes the different characteristics like low income, disabling condition, history of homelessness and
Disability.
yeah.
Yep.
So that is all captured in the Metro SHS work plan. Now at the end of the Metro SHS work plan, then there's kind of like definitions to our definition. So like what exactly do we mean when we say things like history of homelessness? What would be the months associated with that? Literal homelessness, what does that mean, right? So as Metro's staff over the last year with the oversight committee have been doing work to see how these definitions, not so much the main definition, but the definition of the definitions have been applied to in the region. We just learned about some inconsistencies, mostly around the history of homelessness and how counties were capturing that. There were some scenarios that really under history of homelessness that weren't time bound, that were just like that doesn't make sense at this point in time. They were trying to track towards the imminent risk of long-term homelessness. So that's what we're working with them on, to like update those, and they have agreed to update those, and then to move towards ensuring that when we talk about the history of homelessness, that is in alignment with the definition that we have in the Metro SHS work plan, which is time bound.
I could absorb more time, but I have one more clarification and I'll then listen to others. On the history of homelessness. Do we require, and do the counties have a mechanism for maintaining data about homelessness regardless of location? In other words, if a person meets the definition of homeless in Multnomah County, does Multnomah County know if they were homeless before that in Clackamas County or in Hood River County or in Clark County? And how do they share that information? More complicated outside the three counties, but are we at least sharing it enough so that Washington County knows if they've got someone who they have in their records for 6 months of homelessness? Do they know if that person or family was homeless for 6 months before that in Multnomah County?
Yeah, so this is what I can share, because this is a really great question. It's part of the reason why we're diving into the work. There is like a set of intake questions that folks ask around someone's history of homelessness and what that looked like. So I know that the questions are being asked. Now, how that information is then being entered into the HMIS system is varying between counties in terms of like the level of, so like they might have the information in paper or at a service provider level, but then for us to be able to like assess that on a regional level, I think is what we're currently in the midst of, because not each county is tracking all of those questions that would be asked at the assessment point into HMIS, which would then give us because we don't have access to HMIS, we only get the reports that we get, to be able to like answer that type of question. So it's kind of like we're getting there, but we still have some more work to do to ensure that we have that level of visibility.
ETA?
I'm seeing August being mouth over there. I think that that is when the data
This would
sharing
be
agreement
fabulous.
just. Yeah.
Okay, great. Thanks, Mr. Chair.
Of course, great conversation. Counselor Lewis and then Counselor Huang.
Sure, thank you so much. I really appreciate these reports because we can see that there's work happening on the ground.
Mhm.
And I think the Q3 is kind of where like rubber meets the road on if we're gonna hit your goals. Whereas in your, Q1 and Q2, like if you're less than 50%, it's hard to see like where the momentum is. And it looks like even where we're not meeting exactly where we need to be, the trends are that there's momentum. My concern is that we have some goals and objectives set by the Oversight Committee that are not reflected in this standard report template. And we're gonna get here again, like the third year in a row where the Oversight Committee is going to make the same recommendations. Some of them are around prompt payment of contractors. Some of them are around making sure that we are using discrete data when measuring community impacts of communities of color. So I'm just curious what we're doing to measure in the intermediate, how we're doing against those recommendations that came from the Oversight Committee since at least 2 years in a row. It's basically been a copy and paste of the same thing. We've got great momentum, but at the same time, we have at least one of the 3 counties that is working with a PSH model with a cap of funds spent instead of a floor of funds spent, which means you're not actually doing PSH because you're so limited on the services you can provide an individual you've identified as high needs. So what is our tracker on essentially the homework that the Oversight Committee report last year gave us?
Yeah, no, that's a great question. So as a follow-up to the Oversight Committee recommendations, we do, as Metro staff, kind of develop a work plan and then a tracker that then follows each of those recommendations. So for the different recommendations that you outlined, we are currently in the middle, and we told the Oversight Committee that they would have this work plan and tracker by the end of summer, and we're well on our way to be able to meet that. So that tracker is really a compilation of all the work that both Metro Housing Department is doing to operationalize the recommendations, but also the work that we need to work with the counties on. So in our weekly meetings, monthly meetings with the counties, we are connecting with them on these recommendations and ensuring that they're providing us timely updates towards that. The other thing I'll mention is that the quarterly report is just, as you know, just one of the reports that we have. The annual report that the counties submit on a yearly basis does have a lot more of the information that the Oversight Committee's recommendation. There's a lot more interplay between those two, especially around the work of service provider partnerships, contracting, invoice payments. And that also kind of ties into the work that the Tri-County Planning Body is doing with the employee recruitment and retention plan. So I think that this is the provider partnership ones is that they're integral and they're the backbone of our community. And there's almost like multiple different opportunities that we have to ensure that that work is moving forward by different bodies that's holding that work.
Yeah, no, thank you. I appreciate it. I think the annual report is obviously the place to get into the most detail, and it needs to be that level of detail. But as we learned with 2 recommendations that were so similar, if you're not getting midpoint check-ins and accountability, it's the stuff you put off, right? Like you do your laundry before you dust, and we're never going to find out the small details if we're just continuing to put it off into the future. So I look forward to that tracker coming in, and I will obviously see it oversight, but I hope it comes to this body as well.
Yeah, you can certainly do that.
Thanks, Counselor. Counselor Huang.
Thank you, Counselor Gonzalez. I think the key overarching theme we have for these meetings is how do we create that regional system. And I want at some points where it seemed like some counties were doing kind of unique and great things. So one of them was, you mentioned the unicorn system in Clackamas County. And I know that the data compilation piece is really important for that regional system. So can you go through why that was so successful and like how that might be a model or shared across the rest of the region? And also, like, I guess why unicorn started here and now, sort of thing.
Yeah, no, that's a great question, and I can attempt to answer that question and let me know if I missed something. But yeah, that unicorn model that I raised at Clackamas County, I will also say that the 2 other counties are doing versions of that work. It's just has been in different quarters or in different years. So like, I think all 3 counties are doing some of that work to like better capture what we call it like inflow into homelessness. So like people entering homelessness. And those are also requirements that we have to measure as part of the Metro SHS work plan that we see in the annual reporting. So I think I was just highlighting that Clackamas County this quarter is there in terms of like more intentionally tracking what we are calling their by name list, which is really an integration of different data platforms that they have to ensure that they have more robust and timely accurate data on the number of people that are entering their system in Clackamas County. Multnomah County is doing a version of that as well and is making really great progress. All 3 counties in the metro region are deploying the Built for Zero methodology to capture both inflow and outflow, which is basically tracking the people that are entering into the homeless system and then also being placed or exiting the homeless system. So I think it's just really, great work because the more we can get better data on the inflow and outflow, the more we can support the region with the progress that we're making in context of the need. So it's not so much reporting just on X amount of placements that we have over the years. It's like reporting those placements or those homeless preventions in relation to the context of the broader regional need in our system that can support with policy decisions and further building out a regional system of care here in the region.
Yeah, I mean, to me, that's kind of like both an opportunity, and I think there's a challenge because there's still 3 different methodologies for measuring inflow and outflow. So what are the pathways of like creating one system and one measurement for inflow and outflow, and like how are best practices kind of disseminated? Because it seems like sometimes one county pulls ahead, but that's great because we have that innovation, but then like how does that improve the system region-wide?
Yeah, and I think
any question, but
no, but I think it's a great question that the team thinks and talks about a lot. Because I think that that's exactly why there's such an opportunity with the SHS funding being administrative by Metro, right? Because we do hold that regional lens. So we're able to see the 3 counties like systems and methodologies and then work with them to like morph that into one regional methodology. And I think we've done really incredible work in those areas over the last couple of years. There's obviously more work to do around some of these more, how do we capture the broader need? But I will just note that I think that that's the value of Metro being at the table and having that regional lens to be able to like bring the different work and the different systems at each of the county into.
yeah, I just don't want 3 systems to continue to diverge because we're not doing our part to do that convergence element.
And I'd just like to add something else. You didn't see me get up there, Yesenia. For the record, Liam Frost, Interim Director of Housing here at Metro. I just wanted to add, Councillor, that what you're really getting to there is the regionalism aspect of it. And the question you asked is, innocuous, but at the same time gets to the heart of what we're really trying to do with what Yesenia just described. I think we've talked about the limited nature of our authority or enforcement mechanisms ad nauseum, so I won't belabor that point here. But what we've managed to do over the last few years is build about credibility. Prior to the Metro Housing Department, we had a tiny team that was running the housing bond. And so it's taking a lot of time over the past few years to basically recruit experts, build a team with consistency, with goals for each of those teams. And what we started to do, I think you all got a link to the case conferencing, for example, the alignment with the behavioral health system. We did that. So we're starting to demonstrate a lot of that value, both in terms of the behavioral health piece, but also now we're about to embark on an IGA with PCC, for example. So to unify some of these methods, I think it's going to be up to us to demonstrate some of that value. And I've just spoken to the two of the 6 regional goals from the TCPB, but it's equally applicable here in the SHS oversight realm as well. So I just wanted to add that that's a priority for us, and we're showing it, but I don't think we talk about the building of our credibility enough to show how much influence that we can have across the region. And thank you for the opportunity.
Thank you. And then just one other follow-up, and along kind of the same vein. I noticed for Multnomah County, they had highlighted intertwining of HUD dollars. And I think part of that regional system is just a better understanding of, SHS as an end-all funder that we're leveraging other sources of resources. So like, are the other counties also using HUD dollars? Like, how is HUD funding fitting into the broader system? And is it only Multnomah County that's doing that? No, okay. But yeah, maybe you could expound on that a bit.
Yeah, I can start that. So all 3 counties have HUD funding available to them through their continuum of cares. And I would say all 3 of them are braiding the resources together in their local homeless systems of care. Of course, all 3 of them now are having impact due to the situations that are going down at the federal administration level. But I think that is the additional value, right, that SHS adds. Like all 3 counties had funding and resources. Of course, 2 of them had a lot less than Multnomah County. But I think it's always been that SHS is an additive to their current funding sources. And how do we intentionally leverage and maximize all the funding sources to create one system of care that truly supports all of the different experiences of homelessness in our region. I will just put a plug that in the annual report, we do request that information of all the different funding sources that counties leverage. It's been kind of a work in progress in terms of getting that information and the level of information that we get to do the level of analysis that you're describing. But I definitely feel hopeful that as we continue to update those reporting templates and get really clear on the type of information that we need, we'll be able to better speak to all the different funding sources out in our community and how they are all working together to support the homelessness issue.
Thank you.
Great. Councilor Rosenthal?
Thank you, Councilor. Thank you, Councilor Gonzalez. First of all, I want to say, it's encouraging. The Q3 reports are encouraging, and it sounds a lot like things are sort of coming together. It's been a lot of work. I know that you guys have been working very hard, and there's been a lot of, shall we say, disparate opinions on data collected, on how to report, how to communicate, and how to coordinate. But I think it seems like we're finally getting on sort of a common wavelength, if not identical in all regards. And I think that's very good. And I appreciate the report. I have 2 sort of broad questions. One question is, are we collecting any data or is anybody collecting any data on how we're serving the youth population that falls between this, A and B categories? They move in and out of A and B categories. And then the question is, it seems like considering the number of placements we've made and the number of housing units that we created, are we going to be running out of housing to put people into pretty soon?
Yeah, on your first question, so each county has different systems of care by population that they administer in their county. So they do have more specific youth programming. So even though in the quarterly reports, you don't see specific information as a subset of the population that they are serving, we are getting that level of information in terms of youth being served in the data sharing agreement. So we will get date of births and ages. So we will be able to answer any questions that you have or run analysis on the different populations that are being served and how homelessness really is an issue that impacts, young to older families, single. So being able to better illustrate the different experiences and populations served with SHS funded programming. On your second question, in terms of, if I understood correctly, are we going to run out of housing? And I think a lot of service providers would say that there is already like very limited housing and we need much more affordable housing in our community. We are deploying different strategies to work with private landlords, but I think there continues to be a need for more affordable housing in our region, and like continuing to find opportunities to build that out feels like a critical way to like solve the homelessness dynamic that we have in our community. But
The only thing I'd add there too is that we're going to be this summer looking at working with some of the local CDCs and regional CDCs. For example, Margaret Salazar from Reach CDC recently testified at a TCPB meeting talking about some of the vacant units, available units in their portfolio. So it gets more complex pretty fast, but I want to let you know that we're going to be talking to some of those CDCs this summer.
Yeah, one of the questions would be, do we know if there's a limit on the number of conversions that are possible? From existing, there's limits on that. A lot of people have said we should explore more of that. I mean, you hear that a lot, but there's also limits.
Are you referring to conversions of
Existing hotels, motels, or even rental units?
Yeah, it's been challenging from the ground up, and I can talk more about that in our one-on-one. I think we have one later today. Yep.
All right.
Great. Councilor Wong, did you have your hand up again, or is it a hangover hand? All right, great, thanks. Councilor Rosa, okay, great. Well, thank you for coming. I think there's like a whole school of work happening, outside of the context of these reports around alignment and accountability and how we continue to deliver on the mission. So I want to make sure that stays, that there. And I do have some like general just questions, comments, and hopefully encouragement that I'm thinking about. And from my background in the work that I've done as a fundraiser and strategist and things like that is, one, I've been thinking a lot about our shared agenda. And I really appreciate Councilor Wong talking about federal resources and HUD and things like that. And I know that over the last few years I've talked about this, but I really want to see Metro in the 3 counties showing up in Salem and in DC saying this is what we need. And so I guess if there's a question in there is what else do we need to do as a council and as an agency to foster that kind of collaboration? So that's my first question. Second, and this goes again to the question of state and federal money that is being braided with our SHS money is leverage. So in our reports, or at least in what we shared right now, is like that like sense of leverage. I would like to be in a position where we could talk to voters and say, yeah, we're raising a lot of money, but we're leveraging it in this way. And so I think for kind of that toolkit and discussion, and at the same time, on the other side of that coin is, given the administration and the uncertainty of funding is, really, I think being able to talk about the perilous moment that we're in and helping folks understand like the work that we're doing and through a lens of education, but also through a lens of leverage and how we can continue to drive that. Because at the end of the day, it is going to take, more dedicated and focused resources in the gaps that we've all just talked about. And I think lastly, what I'm thinking about is like, what's a good call to action for folks, not just like the inside baseball and the commissions and the council. I think we're actively, working on how do we get folks to rebuild their trust in their local governments as it relates to homelessness. And so what are those calls to action that we can continue to like weave folks into the progress of these reports and clearly the momentum that's going in the right direction. And I want to give some credit to Israel, who I know just stepped out here. But I think one of those calls to action has to be for people in our city and our region is to talk about the progress that we're making and really be clear about what do we want to tell on the national level about the stories that are being written about us versus the work that we're doing that is really impressive, that is collaborative. So kind of curious how we can weave those things, because I do think that if we have an army of ambassadors in our region that sees the work, owns the work, then, you know, the comment section is going to be absolutely blazing. So anyway, those are just some high level thoughts. And I really appreciate the feedback and the discussion that the council has had from the data and definition alignment and, you know, what's in the IGAs. And again, like I'm pointing to the school of work that's happening outside of this work session to really make those structural corrections. But within the context of the presentation and conversation today, I just wanted to add those things and see if there's any reflections from y'all.
I just want to say thank you, Councilor Gonzalez, for the questions and also for the spirit of hopefulness and aspiration. I hope that some of our staff are watching right now and listening to you and your leadership. I'll take the maybe question 1 and question 3, and maybe Yesenia can take the question on leveraging. The first question, I think it was, what can council do in terms of advocacy? I think what would be helpful for us is to find areas of alignment with other bodies, other elected bodies, and then hold each other accountable to those commitments and those alignment of goals. We've gotten some feedback from some of our community members, advocates, and service providers recently, and the term making the system election proof is really starting to catch ground a little bit. And I understand what folks are saying. Folks get elected on a 4-year basis and come in with different goals. But when I really unpack that, what I'm hearing folks say is we want our elected officials to champion the work well into the future and create alignment with us. So that's what I'm really hearing when I'm hearing that. Because when you hear words like election proof, there's a tone of distrust there, and that's something that I think you all do an exceptional job of, I'd say, in comparison to other elected bodies too. And that kind of jumps to your third question around there. How do we create an opt-in or a kind of an investment, a shared investment? And this really speaks to a dream of mine, and I hope I'm not getting out of step here a little bit, but Israel and I have talked for years about an ongoing engagement public campaign for folks to commit to the goals of the larger system, not to Metro, not to the city of Portland, not to Clackamas County, but to the larger goals as a community. And we're laying the groundwork for that. It's still very early stages for it, and obviously it depends on a lot of the politics, but we want to work with you all on what that might look like. But it really is entirely dependent on a shared commitment from elected officials at the top. I'll just say a small anecdote. Yesenia and I attended a retreat yesterday with Multnomah County, both the homeless response team and the Homeless Services Department, and then Community Solutions. And we were working with staff, and they kept running into the same brick wall, which is, how do we get our electeds on board to support this work? And you hear that a lot at a staff level. I'll say, and I'll be completely candid and honest, I've not run into that problem here at Metro. You all have been tremendously supportive of our work and continue to do that. I'd like to see other folks do that in other jurisdictions, but it comes back to aligned goals. And that's what we really need your help with. So I'll stop there and hand it over to Yesenia.
Yeah, no, and thank you for all those incredible questions. I will just say to your question around like match and leverage services and other dollars, that's a great question, because homelessness a lot of times is kind of like that backstop for a lot of other system failures that people experience. Yep. And then they end up homelessness, right? So like that larger system integration between the healthcare system, the mental health system, foster care, all of these systems better working together to address the complex needs that an individual that experienced trauma has is critical. So we are still doing work on that. SHS on its own will not solve the homelessness situation that we have in our region. So finding better ways to like integrate with our partners and other systems. I think we're doing really great work in that in the Tri-County Planning Body and others. So like it's really now an exercise of pulling all the information that we're getting together to really be able to like speak to what you're describing as like, how are we leveraging SHS with like other funding and sources? And like I said earlier, we have a version of that in the annual report. I don't think the list is as comprehensive as it probably can be, mostly because I think we need to do continual work around like a methodology and what exactly do we mean when we say leverage support and things like that. So I appreciate the question. Know that we have some of that I can share, and I think there's further work to be doing there.
Great. Thank you. I appreciate you all. Any other comments or questions? Councilor Lewis?
Yeah, normally I wouldn't respond. I think that was a really nice way to close. But I feel like we have to push through the Portland Nice. And I think the reason why, Liam, we all love and appreciate everything your department does is because the hard stuff happens at the county. And I want to recognize that, right? We have at least one county that never has handed out a tent with public funds. And we've got another county that does a lot of it. And then we've got a mayor who says that's the worst use of public funds because I spend more money cleaning it up than actually helping a person. So that's just one example of how messy it is once you're out of this building and the money's actually being spent. Not only do you have providers, every last one of them saying they would do more with more, but you have difficult choices about philosophical prioritization. And I think when we started this conversation with Councilor Nolan's questions, it was not only about reporting, it was also about evaluation, what actually works and what works for whom and when. And if we don't get the counties to have that conversation, we're gonna have to have it here. And that's gonna get messier, but I kind of welcome it because I don't think we can trust the 3 counties to do it. That's something they should have already started doing when we said, look, more money, more problems. So we're gonna have to have a space for that. And I don't know if we're ready for it. But I thank you for your cheerful end to this conversation. I'm just saying it's gonna get harder before it gets easier.
And if I may respond, thank you for your comments, and I appreciate your points there. I think I try to remind my colleagues in different governments that the distrust in experts isn't just limited to homelessness. There's a culture now that we're living in where experts are actively being derided, both on the right and the left side of the spectrum for different reasons. I think in my dream scenario, we would put elected officials in a room with some of our experts from various sectors, and not even educationally, but to talk about priorities and philosophical differences, because that's the only way we're going to move forward on this. What we're seeing right now is, well, I've just spoken to, I'll stop right there. But thank you very much. I agree with you. And I hope I'm not being naive in my hopefulness.
Yeah, absolutely. I think that's the work with like critical alignment. I mean, Counselor, I think you vocalized that really well. And I think as the program evolves and as we look at what a renewal might mean, that is the fundamental question that I think voters want for us to address, is what is the alignment of the system, and not just on the programs, but on the mission and on the people that we're trying to serve, definition clarification. So yeah. Anyone else want to contribute to the discussion? It's rich, it's good. Okay.
I would just contribute and say, I'm a bit more optimistic than Councilor Lewis. I think that there's going to be some changes, and I think some of the personality issues that have been fairly dominant may have gone away as people realize that we have to attack this as a regional thing. So I'm a little bit more optimistic than she is that it's going to get much worse before it gets better.
Okay. I think we all play a big role in how those shifts happen. And I think we have to own that as a council, both inside and outside. So, okay, great. So I'm going to move into the adjournment of our meeting. But before that, I want to invite Marisa Madrigal, our COO. Thank you so much for the presentation. Look forward to seeing you again in a few months. For Chief Operating Officer Communications. Any updates?
Just a few things today. First, wanted to give kudos and a shout out to our zoo team because Tulutu was not actually in the parade, and instead it was a whole team of folks from the Oregon Zoo who have been involved in activities and all kinds of stuff to represent her and the zoo and Metro. They did an incredible job. So feeling super grateful for that. Also wanted to thank all staff and managers yesterday for managing through the heat. It's just the beginning of summer. This was a good mini heat wave to test our procedures, and grateful to report that our facility stayed open, everybody was safe. You all received an email from me on some restructuring and reporting changes in my office, so just wanted to call your attention to that. And if you have any questions about that or want to go into more depth, happy to do that at our next one-on-ones. And then finally, we are putting together a lean training. So lean is that process improvement framework, and looking at a cohort for Metro of about 20. We would like that cohort to be a mix of folks from council, my office, different departments. I think that's the best way to get some good energy going and cross-pollination. So if that's something that you're interested in participating in, please let me know. It's probably going to be a 3-day stretch. So we're looking at scheduling in the fall, but I'm super excited about it. So if you're interested in participating, let me know. That's it.
Great. Thank you. Counselors, any updates? No? I did see Counselor Lewis did the dragon boat racing this weekend. That was pretty cool.
Yeah, and I would like to thank our Parks and Nature staff for having a tent out there on Saturday with water safety education and life jackets.
Heck yeah. All right. Seeing no further communication and discussion, I will adjourn our work session. Colleagues, our next regular meeting is scheduled for Thursday, June 12th at 10:30 a.m. And council will now convene into an executive session held pursuant to ORS 192.6602D to conduct deliberations with persons designated by the governing body to carry on labor negotiations. We are going to meet in room 375, let's say at 11:50.